Hello everyone, myself Vivek Devani and my topic is myocardial infarction. So now let's discuss about myocardial infarction. Before discussing about myocardial infarction, let's see which kind of disease is myocardial infarction, what is happening in myocardial infarction. So myocardial infarction is a type of coronary artery diseases. Coronary artery disease is also known as atherosclerotic heart disease, atherosclerotic cardiovascular disease, ischemic heart disease, or coronary heart diseases. This disease is caused by buildup of plaque along the inner arteries of the heart, which narrows the artery and which will ultimately lead to reduced blood flow to the heart. So now let's see the myocardial oxygen supply and demand. So it should be in a balance first of all, and the oxygen supplies depend on three main features. The three main features are the delivery of oxygenated blood in coronary arteries, the oxygen giving capacity of the arterial blood, and third is ability of myocardial cells to extract oxygen from the arterial blood. And the patients first of all who are having the myocardial infarction, when the patient first come to the doctor or any other clinics, the patient will make a fist and he will put that fist on his heart region, on the left side of the chest. This is the first sign which is showing that patient is having either myocardial infarction or unstable angina. And patient will walk like this. He will make a fist, he will bend forward, and he will and the pain will be radiating like this. Imagine this is a person who is having myocardial infarction or a angina. Will make a fist like this, and the area which will be paining more will be starting from here to here. The pain will be radiating in all this part. His shoulder tips, his arm, his forearm, his left chest, his heart region, everywhere. The sign which we have seen, in which the patients make a fist and bend forward and walk, is known as a Levine sign, and when this sign is present, it is known as Levine sign positive. So now let's see what is myocardial infarction. So myocardial infarction occurs as a result of interruption of blood supply to an area of myocardium for 20 minutes or more, causing tissue necrosis. In more than 80% of the cases, myocardial infarction is precipitated by the thrombosis due to disruption of fibrosis cap or superficial erosion of the endothelium of an atheromatous plaque. Less often it is produced by a coronary spasm, embolism, and thrombosis in normal coronary artery. In simple points, if I can explain it like that, there is a presence of thrombus in any of the artery, and when the thrombus leads to coronary artery, the thrombus will grow slowly, and then it will reach to heart, and it will hamper the blood supply of the heart, and that's the reason the myocardial infarction will occur in a normal individual. Now let's see the types of myocardial infarction. Two types are there: transmural and non-transmural. Transmural and non-transmural. The first one is transmural. It is characterized by ischemic necrosis of full thickness of the affected muscle segment. It can be anterior, posterior, and lateral wall of left ventricle. Now let's see non-transmural. The area of ischemic necrosis is limited to either endocardium or the endocardium and myocardium. The acute myocardial infarction will usually be classified according to the presence or absence of ST segment elevation. For that we need to see the ECG, and ECG will show if the ECG is showing the ST segment elevation, we can come to know that the myocardial infarction is present or not. Now let's see some of the ECG signs of myocardial infarction. You can see that this is a normal wave of ECG. This point where it is showing, this is known as the ST segment elevation, which which shows the acute injury. This is a T wave inversion ischemia. This wave shows T wave inversion ischemia, and this wave shows pathological Q wave necrosis. So now let's see the risk factors. The risk factors may include age, gender, family history of ischemic heart diseases, some patients with hypertension, life or any other stress, the person who is consuming more and more alcohol, tobacco and smoking, the person who is more obese means obesity, and the persons who are taking any kind of drug means drug abuse. So now let's see the clinical manifestations. So there will be severe crushing chest pain. The person will having severe chest pain, and maybe there will be Levine sign positive. That means that the whole left arm, shoulder tape, left chest, everything will be paining. Diaphoresis, dyspnea, nausea, vomiting, dizziness, apprehensions. The person will feel weakness. ST segment of elevation when it will be checked in ECG, and elevation of specific serum enzyme or isoenzymes in the body. Okay, now let's see the pathophysiology of myocardial infarction. First, there will be some or the other cause which will cause damage to the endothelial layer, which will further lead to digestion of lipids in the internal layer. Then T lymphocytes and monocytes infiltrate the area to ingest the lipid and die. After ingesting, they will just die. This will further lead to smooth muscle cells in the vessel multiplies and forms a fibrous cap over the fatty area of fatty core or plaque. They will cause a fatty core or plaque over the multiple vessels. Plaque will protrude in the lumen of the vessel, causing narrowing of the blood vessels. It will further lead to fibrosis cap of the plaque will be thick and lipid pool remain stable. It can resist stress of blood flow. And if the fibrous is thin, as lipid core goes causing rupture of cap and bleeding the plaque, then there will be formation of thrombus. This thrombus may obstruct the blood flow to the coronary artery, and thus it can lead to myocardial infarction. And so myocardial infarction is caused. Now let's see about its management. So management can be divided into three. The first is medical, second is surgical, and the third one is physiotherapy. So the medical management includes rest. The person needs rest. Then analgesic and sedatives. The medical doctor should provide the person with analgesic and sedatives, anticoagulants, vasodilators, antiarrhythmia, and the most important thing is oxygen therapy is must needed for the myocardial infarction patients. So now let's see the surgical management. So surgical management are of two. First one is PTCA, which is percutaneous transluminal coronary angiography, and second is CABG, which is coronary artery bypass graphy, which is in layman term it is known as bypass. Many people say that they have undergone the bypass surgery. That is nothing but CABG. Now let's go to physiotherapy management. Physiotherapy management includes pre or post operative cardiac rehabilitation. There will be several exercises such as breathing exercises which will help the patient to breathe normally and live happily and maintain their quality of life.
Thank you all for listening me.